Okay, so I love the knee. I think the knee is fascinating. I spend a lot of time working with the knee. My practice is a bit interesting because I split my time between acute pain medicine and regional anesthesia and perioperative pain management, and in addition to that, having a huge love of my chronic pain patients and doing anything I can and sticking needles into them and doing things to them to make it not hurt. So I get to work with acute pain and chronic pain, and here we are. Let's talk a little bit about the knee. We're going to talk a little bit today about basic things like prevalence of knee pain, differential diagnosis, a few statistics to throw in there. We're going to talk a little bit about RFA, which everybody knows about. This is not exactly a new concept, but there are some other options out there on the table that could be your competition with RFA that we should at least be aware of if we're going to be having an open-minded approach and a thoughtful approach to how we approach the knee. And also, what is the future of this area?